Welcome to today's video, where we'll be diving into a fascinating and sometimes debilitating condition, tarsal tunnel syndrome. We'll explore its causes, symptoms, diagnosis, treatment, and more. So, if you're experiencing foot pain or just curious to learn, stick around. Tarsal tunnel syndrome, or TTS, arises from the compression or squeezing of the posterior tibial nerve as it travels through the tarsal tunnel. This tunnel is a narrow space located on the inside of your ankle, bound by bone and the flexor retinaculum, a thick band of fibrous tissue. Several factors can lead to this compression. These include flat feet, which can strain the nerve, injuries like ankle sprains that cause inflammation and swelling, space-occupying lesions such as cysts or tumors, systemic diseases like diabetes and arthritis that can affect nerve health, or even simply wearing tight shoes that put pressure on the area. Sometimes, the exact cause remains unknown. The pathophysiology of tarsal tunnel syndrome revolves around the posterior tibial nerve's compromised function. When the nerve is compressed, it restricts blood flow and disrupts the nerve's ability to transmit signals effectively. This compression leads to demyelination, a process where the protective myelin sheath around the nerve fibers is damaged. Demyelination impairs nerve conduction, leading to the characteristic pain, numbness, and tingling associated with TTS. Prolonged compression can even cause nerve damage and atrophy of the muscles it innervates. While precise figures are elusive, tarsal tunnel syndrome is considered a relatively uncommon condition compared to its upper extremity counterpart, carpal tunnel syndrome. It affects people of all ages and activity levels, though it's frequently seen in athletes, particularly runners, and individuals whose occupations involve prolonged standing or repetitive foot movements. Conditions like diabetes, arthritis, and obesity increase the risk of developing TTS. The symptoms of tarsal tunnel syndrome can vary, but the most common include pain, numbness, and tingling in the foot and ankle. This discomfort often radiates into the arch of the foot, heel, toes, and even up the calf. Many individuals describe the pain as burning, shooting, or electrical in nature. Symptoms may worsen with activity, prolonged standing, or specific footwear. Some may experience a feeling of heaviness in the foot, muscle weakness, or even changes in temperature sensation. These symptoms tend to be worse at night. Diagnosing tarsal tunnel syndrome typically involves a thorough physical examination by a healthcare professional. This includes assessing your symptoms, medical history, and performing specific tests like the Tinel's sign, where tapping over the tibial nerve elicits tingling or pain, and the dorsiflexion aversion test, which involves holding the foot in a specific position to provoke symptoms. Nerve conduction studies and electromyography, or EMG, can help confirm the diagnosis and assess the extent of nerve damage. Imaging studies like MRI may be used to rule out other conditions or identify space-occupying lesions. While tarsal tunnel syndrome isn't formally classified into distinct types, it can be categorized based on the underlying cause or the severity of nerve compression. For example, it may be classified as traumatic, compressive, or idiopathic, depending on the etiology. Severity can range from mild, intermittent symptoms to chronic, debilitating pain with significant nerve damage. Treatment for tarsal tunnel syndrome aims to relieve nerve compression and reduce symptoms. Initial conservative measures often include rest, ice, compression, and elevation, commonly known as RCE. Nonsteroidal anti-inflammatory drugs or NSAIDs may help reduce pain and inflammation. Physical therapy plays a crucial role in improving foot and ankle mechanics, strengthening muscles, and providing pain relief through modalities like ultrasound or electrical stimulation. Orthotics, like custom arch supports, can help correct foot alignment and reduce strain on the tibial nerve. In some cases, corticosteroid injections may be administered to reduce inflammation around the nerve. When conservative measures fail, surgical decompression of the tarsal tunnel may be considered to release pressure on the nerve. Preventing tarsal tunnel syndrome involves addressing modifiable risk factors, maintaining a healthy weight, managing underlying medical conditions like diabetes, and wearing supportive footwear with good arch support are essential. If you're an athlete, proper training techniques, stretching exercises, and avoiding overuse injuries can help prevent TTS. Listen to your body and address any early signs of foot or ankle pain promptly. The prognosis for tarsal tunnel syndrome varies depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and conservative management often lead to good outcomes. However, chronic or severe cases may require surgery, and even then, complete symptom relief isn't always guaranteed. Recent research is focusing on developing more effective diagnostic tools, exploring novel surgical techniques, and investigating the potential of regenerative medicine to promote nerve healing. Furthermore, there is increasing interest in understanding the biomechanical factors that contribute to TTS and developing targeted interventions to address them.